Hey guys, thank you so much for joining us. We're just going to get started in about 5 minutes. Let some people join in. So maybe 6:05 sharp, we'll get started.
What's up, guy? How you doing? Yeah, if everyone can comment on where they're from, that'd be dope. We say hello. What's up, guy? How you doing? Yeah, if everyone can comment on where they're from, that'd be dope. We say hello. What's up, guy? How you doing? Yeah, if everyone can comment on where they're from, that'd be dope. Say hello. What's up, guy? How you doing? Yeah, if everyone can comment on where they're from, that'd be dope. Say hello.
Okay, guys, we'll go ahead and get started. First of all, thank you so much, everybody, for joining. We really appreciate all the support. Y'all are awesome. I think you're in for a really good session today. Van's really cool, and he put so much work into making this session amazing for you guys. So we're really excited. You should be really excited. Just real quick, we'll go over the quiz at the end and how that'll work.
So this time it's going to be a little different. We've done it like this once before, but it's going to be 3 questions long this time with just a very small summary at the end. If you get 2 out of the 3 questions correct, you'll receive the certificate within about a week.
Okay, awesome. And then only other thing is we like to see you being as active in the chat as you like to be. Van's going to be trying to keep an eye on it, but I'm of course going to be watching it the whole time. So any question that you have, anything that you want to ask, feel free, and I'll try and relay it over to Van somewhere throughout the presentation. But yeah, guys, I think that's everything. Thank you so much. We're really excited. Okay, Van, whenever you're ready, it's all you.
Hey guys, hope you guys are doing well and staying safe. My name is Van, just like the shoe. Thank you so much for joining me today. Thanks for Pre-PAPals for creating this platform and allowing me to speak and share my experience. Just like they said, I did put a lot of work into this. I just want to make sure that the information I presented is it's informative, it's relevant, and I really hope that you guys find it beneficial. So, all the previous PA that presented, they were phenomenal and amazing. But I'm going to take a different approach to this one. Basically, I'm trying to, think back to when I was a student and what I really wanted to know from my shadowing experience. Typically, I like to tailor the shadowing experience to my student. By providing them, relevant information, so they wouldn't be so overwhelmed with all the information. I've never done it with such a big platform before. So if you miss anything, I think this is recorded, so you can always, watch the recording again. I leave plenty of time for the Q&A at the end. So, write down your questions as you go, and then, you can ask me at the end. So today's session is going to be on more than just an orthopedic PA. Yeah, let's do this. Before we get started, just a quick disclosure. The advice that I give you guys is based on my own experience and what I learned from my colleagues and from my research. So I do not speak for anybody else except for myself. And obviously, I don't represent any institution. Now, to paraphrase Jay-Z, you could be anywhere in the world right now, but you choose to be here with me. So I appreciate that. And let's get to it. So just a quick background about me. So I was born and raised in Vietnam. I came here when I was 10 with my family. I'm the youngest of 4 children and the only one to go into medicine. Come from a Asian background. Your parents always wanted you to, go into medicines or lawyers or engineer or something like that. I practiced in Maryland. For my undergrad, I actually went to a local community college, Montgomery College. And then I transferred to Howard University. I got my bachelor there. Then I went back to Howard to get my PA. I did my physician assistant study there. And I got my master at Toro later on. So currently, I've been an orthopedic PA for over 5 years. I'm on my 6th year now, actually. And I did a combination of both surgery and clinic. Predominantly now, I'm just in the clinics, and personally, I don't like surgery. And then recently, I just opened up a office with the group of doctors, and I'm currently running it. I'll go over that in a little bit as well. So these are my hobbies. One of my favorite things is I love to eat. So that's basically what I live for. You can see some of the pictures from my travel. I play soccer. I like to stay active. Netflix, Hulu, Prime. I watch anime, play video games. Pretty much like a regular guy. Moving on. So, from my understanding, the people that attend these virtual shadowing sessions usually are either you guys are pre-PA students, or you guys are people looking to for a direction, or you're exploring your interests, or you could be a student that's not sure which direction in healthcare that you want to take. That being said, my goal for this presentation is for you guys is to help you confirm that the path that you want to take, especially if you are heading into the PA profession, to give you the shadowing hours. If you not sure about, I want you to educate, and I want to educate you on the PA profession itself, and hopefully to offer some kind of clarities and guidance. So, on the right side, this is my goal for you at the end. At the end of this presentation, you should be able to think to yourself like, oh, okay, I think I have an idea of what I should do, and then how a plan, kind of a rough plan on how you should go about it. That's pretty much it. So, I'm sure you guys heard this before by now, but in case you haven't, what is a physician assistant? So, a physician assistant is a medical provider who is trained to practice medicine in pretty much all specialty or settings of medicine. We see patient, we diagnose them, we explain what's going on with them, we give them a treatment plan, we also explain what the treatment plan is, we provide the treatment ourselves. In addition, we provide the counseling. We do order and interpret any imaging or labs if we think it's needed. We also perform, procedures in the office as well. We can write for medication, and then we assist in surgery. Oh, sorry about that. Yeah. So a little history on the PA program. The PA program was first started in Duke University by Dr. Eugene Stead in 1965. So the job was created to decrease the patient load that the doctors have to see, and to increase the healthcare access, especially in the primary care. So that's our training approaches to the primary care. The other reason was Dr. Eugene noticed that there was Navy corpsmen that had the medical training, but they didn't have a profession yet. So he wanted to utilize them, and also this was a way for him to reintroduce them into civilian life. Requirement for being the PA, obviously you got to learn medicine, so you have to go to a accredited program. It's basically a med school condensed to 2.5 to 3 years, and you earn a master's degree. Excuse me. Once you do that, you take your board exam, you pass the board exam, and then you apply for your license. Every 10 years, you have to retake your recertification. And then every 2 years, you have to maintain what's called you have to get 100 hours of CME, which is continuing medical education, in addition to maintaining your license. So let's move this real quick. So this is early in my career. So I work Monday to Wednesday in the clinic, and then my surgery days are Thursday and Friday. So in the clinic, I 8 a.m. to 4 p.m. I have call 1 week a month, just by phone, but so I don't have to go in. That's pretty easy, actually. So typical day would be, I go in at 8, I see the patients, I do the note. Well, my first year, I basically spent a lot of time reading on the condition or reading on things that I don't know in between patients or during my downtime. As I mentioned before, I love to eat, so I tend to snack a lot. Then at lunch, we'll break lunch break from 12 to 1. I eat, and then I usually take a power nap for 20 to 30 minutes. Highly recommend naps. It just gets you feeling really refreshed. Then come back to clinic, do the same thing, finish charting, seeing patients, and do all the notes for about 4:30, 5 o'clock, sometime later. the workplace has a pretty big physical therapy facility, so I just stay there to to gym, and then I go home. This slide is to tell you guys what my surgery days are like. So Thursday and Friday, Thursday surgery 8 o'clock start, meaning you got to be there 7:45. Make sure you change in your scrubs. You change into scrubs when you get there. Sometimes it starts earlier, depend on how many cases and then the time slot that they schedule the case. Once you change, you go around on your patients. After that, you go check out the OR to make sure everything is set up well. In terms of setup, you gotta make sure you check the equipments, the lights in the good position, the tables in the right position for the case, gowns, monitor. You gotta make sure you set up the monitors. The key to a successful surgery is preparation. And the surgeon I used to work with, he used to tell me do the same thing every time, so it become routine, and then you don't have to think about it, just be like clockwork. Then you come out, you take the patient back to the OR, and then you prep them for surgery. Here, when you prep, depend on the doctor and also the anesthesiologist. You can actually ask them. You can intubate the patient. You can do nerve block. Obviously, you got to put the patient in the optimal position for surgery. Clean the air for surgery. Then you do the actual surgery. So during the actual surgery, what you want to do, you actually read a procedure ahead of time, because the key goal is you want to anticipate the surgeon's next move, so it's become very fluid and make it efficient and fast. Now, the thing about orthopedic surgery, it's not very elegant. It's very aggressive, forceful. You go in, you're holding a retractor, you're cutting things open. We're using power tools. We hammer. We take out stuff. We put in stuff if we need to. We use saw. We cut things. So once the surgery is done, the surgeon leaves the room. You stay behind and you close. You close meaning you suture up the incision. You apply the clean bandage and then any bracing if you need to. Then you wake up the patient, wheel them out to the recovery room, put them in any additional orders of medication and get them ready for discharge. And then you repeat for the next patient. You do it again. This slide is just a quick comparison between surgery at the surgery center versus the hospital. So surgery center is outpatient, usually reserved for healthy patients because we're not anticipating any really difficult complication. So this is why it's called outpatient. They go home the same day. Usually when you work in the surgery center, it's very efficient, it's fast. You work with the same people every time. And then you can leave early as soon as the cases are done. Typically I'll be done maybe 12, most of the time around 2 p.m. And for the hospital, this is utilized for patient with high risk in anticipation of any complication. They usually stay overnight, so this is called inpatient. Now, it depends on the hospital, but in my experience, it was slower. You tend to work with different staff. And then if they stay over at night, then you have to round on the weekends on them. Once you round, you go see them, and then you go do the notes, communicate with the staff, and you get out of it and you go on with your day. Now, quick pros and cons of surgery. Again, this is based on my experience, but I think majority of surgical PA would agree. So the pros of doing surgery would be it's a change of scenery. You get to utilize your hands a lot. You get to work with your hands. It's fun to use power tools, and then you can leave as soon as you get done. And main thing is you don't have to talk to the patient as much, so it's a good break from seeing patients and to change the pace. For me, the cons would be it's physically tiring. I mean, you have to stand a lot. It's physically demanding. You have to wait around for people. It's not efficient, and when it's busy, there's no downtime, so there's no time to eat, and you just got to eat in between patient or literally whenever you can. And the weekend rounds. What I do now, now I I run a clinic, so clinic hours still the same. I work by myself, autonomously. You can work independently, depend on the relationship that you have with your supervising physician. So the degree of autonomy is actually earned, over time. You got to earn the physician's respect, and then earn his trust, basically, and then you can function pretty much on your own. As long as the law say, as long as you're able to reach your the supervising doctor by phone or electronically, you should be fine. But this varies from state to state, so you have to read into that. In addition to seeing patient, I do a lot more business related stuff, phone calls, emails, setting up emails, marketing stuff, keep track of inventory, data collection and analysis of data. And one of the new thing I'm doing is I'm mentoring more, and then I'm branching out into preceptorship and then possibly teaching. Take a quick break real quick.
Real quick, Van, while you take that break, there's a lot of people who agree with what you're saying, and there's a lot of people on the same wavelength with the anime, snacks, all that good stuff. Okay. People talking about how they do that too. We do have a few questions if you want to take a break and answer some right now.
Yeah.
Okay, let's see. So Brianna's asking, is it possible to specialize in orthopedic sports medicine and only work with like college or professional sports players?
Yes, it depends on the clinic you work with and the doctor that you work with. Now, usually at big facility, then they tend to get all the professional and then collegiate player. In my experience, I work with the professional women's soccer team. The doctors at my clinic, we provide care for them. So I was part of the medical team there.
Wow, that's really cool. I didn't know that. That's awesome.
I did work a lot with college athlete and very high level soccer player that was recruited to a lot of Division I school. So I work with a lot of Division I athlete as well. So that depend on where you work.
That's incredible. Yeah, it seems like in the audience we have a lot of people that were student athletes or athletes at some point. So that's really cool to know. But let's see. Valeria is asking, how do you go about getting your CME?
Good question. So the easiest way to get CME is through a conference. Usually it's expensive and depend how serious you are about your study, or you can go play hooky. But yeah, you sign up for a conference, and then they usually give you I don't know, depending on the conference, they can get it. That's how you can get it. Otherwise, there's a lot of articles that you can read. Basically, same thing you guys doing. You take a pre-quiz, you read the article, and then you answer the post question. You have to get 80% or higher to get the credit. So yeah, that's what I do on the side. Where you have to continue your study. One thing I'll mention on that is there's actually two category of CME. Category 1, category 2, but you'll learn all that once you get there, so it's not important right now.
That's really cool. So we didn't even know, but we're getting ready for our CMEs by default just by being a part of Pre-PAPals, right?
Right. Actually, yeah, this does count, as CME for me.
Oh wow, awesome! I had no idea. Very cool. Let's see. So maybe a couple more, and then I'll let you get back to it.
Cool.
Ashley's asking, what are some good snack foods to have throughout the workday? And she said she likes to snack throughout the day too.
It varies. It depends how healthy you want to be. If you are healthy, then celery is really good. I like bell peppers. Otherwise, I also like beef jerky. I'm a big fan of beef jerky. Trail mix mixed nuts. It's really good. Yogurt. Yeah. Then sometimes I eat these Welch fruit packs.
Oh,
Oh,
those fruit snacks.
fruit snacks.
Yeah. So
Yeah.
that's what I usually eat.
Yeah.
But
All right, perfect. And then one more kind of lighthearted question. Christian is asking, what's your favorite anime? He's a big Naruto guy.
oh yeah, I actually did finish the entire series of Naruto.
Oh my god, that's insane. It's like 1,000 episodes or something, right?
I don't know, but it was a lot.
That's an
Um,
accomplishment right there.
yeah, I'm not sure if I have a favorite anime, but I've been watching a few that was pretty good. My one, early one that I started, Death Note, that was very interesting.
Yeah.
But that was a pretty good one.
Yeah, that's a good one for those 10,000 IQ people. If you can really follow along. For me,
Right.
it all goes over my head. I'm like, what? But yeah, we do have a few more questions, but I'll just save them till the Q&A. They're more general type stuff, and then we'll get back to you if we have anything that's like right on topic.
Cool. Sounds good.
Thank you.
So this is actually a and well, I'm sure you guys will have questions on this. This slide is basically what I do, kind of manage that work-life balance. Some of the stuff I actually done the same thing from PA school, and this is the things that I'm doing to basically keep me sane. Number one thing that I always do, I always try to finish everything I do at work before I leave. So as soon as I leave work, that's that. I leave everything at work. It helps. I don't take work home with me. Rarely, very, very rarely. Um, except when I'm on call once a week. I'm sorry, once a month, and that's rare too. It helps kind of separate work and then your private life. So that's something I do a lot, and I recommend it. A lot of time we have to do a lot of notes, and we can't finish them at work, so you gotta take it home with you. I play sports at least once a week, and and it's a gym in between. So this is the same thing that I've done in PA school. I always take at least half a day to myself each week, to do whatever I want, and that's what help me with the stress relief, and it's kind of clear my head. And it wasn't about like 2 years after working, then I really remind myself like, hey, I work to support my living, not the other way around. So that's when I really started traveling and taking time off. I used to travel 3 to 4 times a year, minimum. It varies between short trips and long trips. So this to give you a little glimpse of a what is it, that lifestyle you guys were looking for when you consider the PA profession. And then when I went on vacation, afterwards I found myself being a lot more productive, like re-energized, and I can focus better, and it helps avoid burnout. But now, currently, because of the project that I took on, I accept. I'm willing to make the sacrifices that I'm in that grind mode, like when I was in PA school, where I'm gonna work harder. I'm gonna work extra hours, and then I'm gonna hold off my traveling for the next 2 years. So I'm not planning on going anywhere. And then COVID kind of make it easier, I guess. But I still do, take that one day off to myself a week. Oh, and don't forget to catch up with your friends. Talk to your friends. They help you, so you don't think about work. So I do have a lot of case studies I could share with you guys. So, but I figure, you guys gonna learn medicine later on. So I'm gonna hold off on that. I'm gonna focus, breeze through this. So this is a standard write-up for a case that I saw. I will tell you why I picked this case a little bit later on. But the takeaway from this slide that I want you to take away is 50% of the time, you can figure out what's wrong with the patient just by listening to them. Honestly, it's just talking. So learn to take a really good history and then listen well, like actively listening. So yeah, learning this skill will make you a really good student and also a really good provider when it's your turn. Again, this is just a very sample write-up. You can see here in the physical exam, it's just a whole bunch of words and people's name that doctors like to name themselves after things. That happens a lot in medicine. So as you can see there, one thing I will point out is the x-ray on the left. You can see this normal, where you have normal joint space. This is what's called a joint space in between your thigh bone and your shin bone. This is arthritis, where basically that you're losing that space and the bones are touching each other. And this is how you would describe an x-ray reading in orthopedic, or how I would describe this x-ray. Differential diagnosis for this case, knee arthritis. Actually, no, the one thing I want you to take away from this is differential diagnosis is a list of condition that what you think the patient could have, starting with what's most likely to least likely. And then you always want to include anything that could really be detrimental to the patient, such as reactive arthritis, or also known as Reiter syndrome, or cancer, because obviously this thing can lead to emergent problem. Cancer, if you catch it early, you can save that life. So you want to rule that out too. This is a standard treatment algorithm. So what matters is this is what makes medicine an art. So basically we all have the same treatment algorithm. It's where you choose to start, where in the treatment plan that you choose to start, and then what combination. That's what make medicine an art. So for this patient, he came in, as you read earlier, this patient was like a really older gentleman, very Russian guy, big guy, very stoic when he came in, barely spoke any English. He spoke through his I think granddaughter at the time. He had this knee pain for a while. No one ever treated it yet. So I'm coming in. He came in to see me. I explained to him what's going on, and then I recommend doing an injection. He was hesitant, but then he was in so much pain that he was like, "All right, let's do it." So I did the injection, then do the exam again. Basically, I asked him to basically walk around, and then he didn't have any more pain. So what that means is you did the injection right, and then the treatment plan is successful, it's appropriate. And the reason why I picked this case was, the patient was happy. He was happy that he's not in pain anymore. He stood up and then he gave me a hug before he left. That was huge, because when I first came in, I'm like, holy crap, this guy is pretty intimidating. With he had tattoos and stuff, it was pretty intimidating. But yeah, so I was just glad that I was able to give him some relief, and then that he gave me a hug on his way out. So orthopedic is one of the few specialty that you can get this immediate reward. Where I can just make the patient stay in pain, you can make him make the pain go away, and that's like you get that instant gratification. This is just a summary. I'm going to next. I'm gonna go into why I became a PA, why I picked ortho, and then why I'm doing business. I'm gonna take a sip of water real quick, guys.
That's a really cool case study because, like you said, we're mostly pre-PA, so we don't understand all of the medicine necessarily. I know some people are really smart, but that's like something that everyone can understand. But your takeaway is that you get that instant gratification when you met this dude. He's like this big, burly, stoic, scary guy, but then all of a sudden he's giving you a hug. So anybody can understand that. That's so cool.
Right. If you guys haven't noticed, for some reason, I'm nervous doing this, so my voice keep breaking.
Not at all. You're fine. You're fine.
All right. So, why I became a PA? This is what I went through. This is my thought process. It was a combination of practical reason and then sentimental reason. So being an immigrant, come from a immigrant family, low key, I knew that I couldn't rely on my parents because when we came here, they were a little bit older. They were older, so they couldn't get that advanced job, with a high salary. So I knew I had to do something for myself. Um, so coming out of high school, I had no idea what I wanted to do, but for some reason, I had a gut feeling that I should head towards medicine. Actually, it was from I took some pre-tests, one of those tests to kind of help you figure it out back in middle school. Actually, the whole school made us take it, and then to say something medical related. I'm like, oh, okay. I just remember that experience. I think that's what triggered the the gut feeling. And yeah, I honestly didn't know anything about the PA profession. Actually, I didn't even know the profession existed. But what happened was I at the Montgomery College, at a community college, I was in my swimming class. Um, we were just hanging out. One of my classmates actually told me about the program. Actually, no, he told me about the profession. And so my immediate answer was like, what the heck is a PA? And then he also told me about the Howard University and then the program that they offer there. Yeah, I'm gonna tell you guys of that a little bit later on, because it ties in with my story of how I interview and such. So I'll share that why I pick Howard later on. But yeah, so after that event, I was intrigued enough, so I just kind of went home. I did some research on it, and then I still didn't know what I was reading. So I decided, I'm like, let me just go volunteer. So I volunteer in the hospital, in the ER, and luckily I got to work with a PA there. So I shadow a PA there, and then just seeing how happy he was, at his job, like how much he enjoyed his job. In addition, when he was sharing me stuff what he does outside of work, he basically worked 3 days a week, and he have like a mini vacation every week, and that was like, I was like, this is awesome. So just seeing that's confirmed from like, this is it. I don't know what this is, but I want to be happy just like this guy. So yeah, I kind of helped made up my mind there. The key realization there was I wasn't sure I was gonna love this profession or not. But I can see myself doing it, and then I could tolerate it. So I thought to myself, why not? As I did learn more about it, the PA professions kind of match up, with my lifestyle. It's offered as financial security, and then it's still allows you to live. You don't, as I mentioned earlier, it's allowed me to travel. Now, the sentimental reason, uh, mainly, yeah, actually, I didn't think about it, but yeah, I wanted to make my parents proud since I was the only child pursuing medicine. Now, the mentoring part, I didn't realize that until like a couple years after I started working. This is really cheesy, but it's true. Okay. Um, I really wish I had a mentor like myself when I was in your position. So this is why I think mentoring is important, and I'm just paying it forward. The other thing is I get a lot of personal joy and satisfaction from seeing you guys flourish. I've seen my student from where they started to where they are now, become a professional. Seeing that progression is very fulfilling, and it's really rewarding. It's cheesy as that sounds, it's actually, yeah, it's true. That was a lot. Whew. All right. So why orthopedic? I grew up playing sports. I just kind of had a natural affinity for it. I was kind of naturally good at it. Also, it was my first job offer out of school, so I didn't bother looking anywhere else. I kind of got lazy, not looking actually. So if I were to go back, I would definitely consider uh, my moonlighting, or basically getting a part-time job or a second job in the urgent care or emergency room or primary care. Um, the reason why I would do this is it actually allow if you choose to kind of switch specialty, this allows you to it open up more opportunity, and then you can attract a lot more more job offers. Um, Again, I mentioned earlier I picked orthopedics because it's the one few specialty that give you that instant gratification, and the plus side, no one dies. Yeah, I don't do well with patient not doing well. So me personally, I definitely knock on wood, never had anyone die on me. So yeah. Um, Now for business, I thought it was a new challenge. It's an opportunity for me to grow. But the most important thing here is after 2 years of working, I realized that medicine can actually give you a pretty comfortable life. But then there's it's a stable job too. But there's a ceiling. Granted, doctors had higher ceiling, but then I realized there's gonna be a ceiling. I'm gonna hit the ceiling sometime, and business is a way to break through that ceiling because there is no ceiling with business. It just depends on how far you want to take that business, right? So this is why I'm doing. I got into business. Quick break before we get into the slide because I do think the slide is important, and I'm gonna take my time going over the slides. Okay, so give me a second.
Yeah, definitely. Do you want to take a few questions before you get into this?
Yeah. Let's lighten the mood a little bit.
Awesome. Yeah, definitely. There were a few people asking about the cortisone injection that you gave the patient from the case study. It seems like the most common question is, was that able to treat him like long-term, or was it like a short-term relief?
So arthritis actually have 4 stages to arthritis. The picture I show you is more towards the later stage. Stage 4 would be the end stage. Stage 1 would be mild. So the cortisone injection, it will last longer if you give it to a patient with a mild arthritis. So that can go, for years, or at least 6 years, 6 months minimum.
I see.
As for if you progress to the later stage, like stage 4, they can last for a couple months. Otherwise, they may not last at all. So it varies. But to answer the question, it's not a definitive treatment. It's basically the buy time.
I see. Surgery is always the last option, right? You don't want to go straight to the knee replacement right off the bat.
Yeah, for anything with medicine, you always want to take the conservative approach first before doing anything aggressive.
Sure. Perfect. And then let's see. Anisha's asking, how has COVID affected running a clinic?
It affected greatly. Opening a office in the middle of COVID was difficult. It's difficult because 1, it restricts you from seeing patients. 2, most of the time when you do marketing, it involves going to others' doctor's office so you can kind of meet them face to face. So you can build that relationship. But with COVID, not a lot of offices are open to that. So I have to find different ways to be able to connect with providers, because the reason why you want to connect with providers, they will refer you patients. So I have to find a different way to get patient in the door.
I see. Yeah, so you really have to build that networking ability.
Yeah.
Kind of piggybacking off of that question, Maddie's asking, did you have any business knowledge prior to starting your own business?
Zero.
Wow.
Zero. It was in the back of my mind that, like, all right, I knew business was the way to break through, but I had no idea how to do it. And I didn't really act on it until this year. And it started with Google. I just did a lot of reading, and then I did a lot of learning. That's how it started.
Man, that's a, incredible personality trait to be able to go into the unknown and then really, teach yourself as you go. That's awesome.
Actually, you mentioned a good point. I do want to give you one advice on this is be resourceful. It's gonna help you with PA school. It's gonna help you whatever you want to do. So start building that skill. So I'm like, you know what? If I don't know something, I'm gonna look it up. I'm gonna learn it myself. Or ask someone that knows it. So go learn about it. Once you develop that, that's actually really, really beneficial, and it'll get you really far in life. And it, um, usually in when you interview for PA school, they want to see the same thing. So just like this, I'm like, hey, being able to learn, figure out how to apply for PA school, um, being able to figure out, the answer that you don't know, because even your teacher, they're not gonna know all the medicine, and then they'll give you an assignment where you have to look it up and then get the answer. So
Yeah.
practice.
Definitely. Very good point. I mean, you can have all the natural smarts in the world, but if you don't have that ability to go out and like be proactive and want to learn, then definitely.
Yeah.
But yeah, I think we're pretty much caught up on the questions
Cool.
if you're ready.
Yeah. I am. So, this slide, obviously, I spent a lot of time making it, but basically, comparing medical school, physician assistant school, as well as nurse practitioner. I'm not only comparing the school, but I'm comparing the profession itself. And hopefully this kind of gives you guys an idea to a little bit of pros and cons of about each profession, then kind of help you navigate and help you figure out which route you want to take. So we'll start first with the MD medical school. Typically the medical school usually takes 6 to 7 years after you get your bachelor. Basically, 10 years in total, and then you have to do residency. And then after residency, actually, there's something called fellowship. Fellowships allows you to specialize, even further training. That's if you want to do it. Obviously, they're gonna have a higher salary compared to other professions because they spend so much time in school. So, according to this is the I believe it's BOS is um, it's like the Bureau of Labor. So this is where I got the number from. In 2009, the median salary was 208,000. This actually, I think this number might be low. It also depends on the area that you practice. So I think it's probably gonna be and specialty. It should be at least 250 or higher. That I think. Obviously, if you go to medical school, you get that doctor in front of your name. You get the MD at the end of your name, so you get a little bit higher prestige. It may not in this society. It may not be the same as before, but yeah, it's globally recognized. The reason why I mentioned this is obviously you heard of Doctors Without Borders. I actually met a student that this was the reason why she wanted to be a doctor, because she wants to be able to travel to different country and provide treatment. Um, so I told her, have you considered PA school? So she did, but PA can't really do that. I'm gonna go back to that point in a bit. So that's why she picked doctor. Obviously, they can independent sole practitioner. They can work on their own. You have to do a lot of I'm sorry, residency is required. Um, I did put lifestyles on here is because lifestyle is what you make it. So you can still go to get a medical school and still have a life. So that's really just what you make it. Obviously, high school, medical school is really expensive, so you have a high debt. And then actually the last two, I want to correct myself. So there's no flexibility after you specialize, but during your residency, there's some flexibility, meaning you can actually change the specialty that you in. Let's say you would actually I had a friend that was doing surgery residency, and then she found that that's not the life she wanted. It was really tough, and so she switched to internal medicine. So you can change. You do have a little bit of flexibility during residency, but not not after you specialize. Let's go over the nurse practitioner real quick, and then we'll get back to PA. Okay. So nurse practitioner, it varies slightly compared to PA. It will take about 6 to 8 years. It requires at least a master. Um, the salary is actually pretty much very similar to being a PA. The cost of schooling is pretty much the same as PA school. Here's the no doctor title, but then there's actually a doctoral program for NP, and you can always get a doctor in anything. The two main difference between NP and PAs. So NP, they can, just like doctor, they can basically they can be the sole provider. Okay, but then the scope of practice is actually pretty determined by the state. So and it varies from state to state. That being said, they won't have the same flexibility as us. I'll explain more in a second. As for flexibility, so they NP, they do have flexibility where there's a wide range of specialty that they can work in. They can switch specialty if they want to, but it's limited compared to PAs. PAs, we can pretty much go anywhere. NPs is limited to maybe, don't quote me on this, I would guess maybe 7 specialty. The reason being is because of the training model. They don't train in all area of medicine like PAs do. So let's go back to PAs. So for PA, it used to be, you can actually become a PA after 4 years of schooling. That's include 2 years of undergrad and then 2 years of PA school. So you will graduate with a bachelor. Now, from what I learned, the quickest way to become a PA is actually out of high school. They have these 5 years program for a master that you can do. And it can go up to 7, because that's just depend on how long each person takes to matriculate to the program. So for the salary, the median salary in 2019 was about 112,000. It's obviously cheaper than med school, but then this also come down to how much loans you want to take, or how much your lifestyle, basically how much money you want to spend, and that affects your cost. So it's gonna varies. We do require a supervising physician. Now, our scope of practice is determined by the supervising physician compared to the nurse practitioner, where it's determined by the state. So because our scope of practice is determined by the supervising physician, it's basically up to him to allow us what we can do. So that way we have a lot more flexibility, and what we can do a lot more. This, like I say, if you earn their doctor's trust, it basically lets you kind of run it. Obviously, we talk about the flexibility. Flexibility, probably 3 things. Lateral flexibility, meaning you can jump from specialty to different specialty. The other thing, that lifestyle is what you make it. So that's you can work a lot of hours, or you can work just what you want, and then you can still travel. Residency is optional. Same thing for NP. Residency is optional. It's not required. It's open to foreigners. So basically, you can be outside the United States and decide to go to PA school. This I don't know about NP, so I didn't put it on there. So PA is not a globally recognized profession. However, over 15 countries recognize the PA profession. So you can work as a PA outside of North America. The only thing is, once the pay rate drops significantly once you get out of the North America, and also your scope of practice kind of change. There's no doctor title. One thing I do want to highlight, there are bridge programs from PA to MD. However, they don't cut that much time. You know, they maybe take off 1 or 2 years, but it still require you to go back basically to med school and then do your residency and so on. Yeah. I actually had no 3 people. My 2 of my teacher, both of them were PAs for a while, and then they actually went back to medical school. And I had a classmate that after we finished PA school, I think she passed the board too. She was, she passed the board, ready to work, but then she decided, I'm like, hey, she decided to go back to get her MD. Now I believe she's in her 2nd year of doing her residency. Yeah. So hopefully that you guys find that slides helpful. I try to kind of basically do everything for you, present it so it helps you so you can see the big picture and you can see it all, and you can compare, make it a little easier to make a decision. Let me move this around real quick. So here is this. If you still decide to go to PA school, here are some of my tips for you through the pre-PA application, and then the application and the interview process, and what to do afterward. That's what's going to we're going to go into next. So my advice for you guys, actually I tell this to all my students, is whatever it is that you guys think that you guys want to do or that interests you, go experience for yourself. Like go research it. Use social media to reach out to professionals, talk to them, volunteer, ask them to volunteer, shadow, attend these type of events, so you can learn it for yourself. And this is what your own experience would help you determine if this is what you want to do. In addition, you obviously have to look at the situation that you're in. There's a lot of outside factors, your finance, what's the plan that you have for yourself, where do you see yourself, and such. Now, when you get to volunteering or shadowing, obviously be polite, and friendly, and respectful for the staff. Introduce yourself to everybody, from the front desk to the back office. The reason why I say this is what actually helped me land in my first job. Everyone in the office likes me. Ask the MA nurse or any supporting staff if you can help them. Oh, funny thing, you don't have to ask for my permission to go to the bathroom. So you just tell me like, hey, I'm gonna use the bathroom. I'll be right back. Like, cool. we all adults here. But you do want to be available and then ready to see patients. One key thing is don't be afraid of asking what you really want to know. And the more specific questions you ask, you get more out of it. It's a lot easier for us to help you if basically you just be straight up and ask us what you want to know. So in terms of research, once you get that and then you still want to go to PA school, you want to research the school that you want to go to, because different school will have different prerequisites and different requirements. The best way to confirm it is always to call the school itself and contact them so you can get the answer from the school itself and any clarification. So even what I say to do your research is you don't want to waste time taking prerequisites for all the school, because it can take you forever and it can get really expensive. So you do your research. The one thing that I do want to share here is I actually didn't know this before, but you can actually apply while you're in school, or while you can still go to interviews and such while you're still taking classes or while you're in school. As long as you graduate or have your final grade submitted the day you start PA school. Crazy story. I've never met the guy, but during my class, there was actually one student that got into the program, but he was taking I think summer class, and then he didn't get his grade in time for that day, and he ended up he got denied. Yeah, that's what I heard. At least I saw the guy. I remember seeing the guy at school, but like I never met the guy. So yeah, make sure you get all your grades in. Next section is basically how to boost your GPA. Now, if you early in your college career, this is what I found works for me. Is I balance my schedule between really hard class, and then I also taking some easy class. So basically, If I was to take 3 science, which I did, 3 science with labs, I also filter in with some, PE class, some other electives, some easy class to help boost the GPA. Uh, uh, now, if you have a bad grade, I mean, for me, I did retake one of my class to boost my GPA, but if it makes sense to you, financially and time wise, then do it. Otherwise, it's not the end of the world if you have a bad grade. But obviously, none is better. The reason why I said that, because you can always flip this. I think your experience, and then there's other ways to strengthen and balance your application. So having one bad grade or something like that, I think you can turn that into a positive. First section here is pretty easy. I mean, it just, this is what I went through. So Howard University had what's called intra-university application. Basically, I can apply it directly to there because I was a student there already, and it didn't cost me any money because I know, how expensive CASPA can be. So yeah. Now the application process itself, personal statement. Um, I mean, I'm not very good at writing, but what I can tell you is, um, the personal statement is for the school to get to know you. So you want to focus on you, focus on your experience, and how did the experience affects you. Not so much of the experience, like the event itself, like, oh my god, um, that you did this, you compression and such. You witnessed something crazy while you're volunteering. Don't try to teach them the medicine because they're gonna know more than you do. However, they want to know you, so focus on how that experience shaped you and affects you, and then rewrite it as much as you have to until you get it right. Then you apply the CASPA. Everyone knows that. Here's something I didn't know. GAE versus the PACAT. So PACATs and GREs usually they test you on English and math mainly. The PCAT is something new that just came out. I don't know if program's going to adopt it or not. I'm not a big fan of it because I think it just way they just making money. So I'm not a fan of it. So I don't know. But from what I learned from the PCAT is they focus more on science stuff. They focus on anatomy, physiology, microbiology, organic, chem, general and organic, all the science stuff. Make sure you get the PCE or ACE hours, patient care experience versus healthcare experience. I'll verify that in the next slide. But the best way to figure out what school prefer is basically check with the program. You can verify with them. Last thing here is be selective with who you ask for your letter of recommendation. And if you do ask, I do this a lot with my students. I ask them to write the draft. So offer them to write the draft. I mean, this is one way that you will ensure you make sure you have an outstanding letter of recommendation. Then what better way than writing it yourself, right? You talking yourself up. So yeah, the reason why I do it with students is this allow me to get to know the student. It also allowed me to evaluate how they communicate and then how well they can write. Okay. So as we mentioned, PCE versus ACE. So PCE is just patient care experience. Now, according to CASPA, what it means is you're having direct responsibility for patient care, meaning you do a job, a task that basically, that can directly affect the outcome. Basically, you're actually touching the patient. So, for example, if you work at a medical assistant to apply CAS, and then if you didn't apply the CAS correctly, then this can affect the the outcome. Like the fracture may not heal in the correct position. Some of the example of patient care experience, but not limited to, you can list here. So if you guys were to trying to find, these experience, then these are the position that you want to look for or try to apply for. Now, healthcare experience, both pay or unpaid. Um, I'm not gonna read that, but this is my interpretation of it. Is basically it's a job that you perform that doesn't really affect the patient's outcome. For example, best way I can help me understand this is if you're scribing to document, to perform documentation, you can still interact with the patient, but you can't really hurt the patient by just typing. I'm not trying to downplay scribing. I think that's a great job. I try to be a scribe myself. Fortunately, I didn't get it, but that's a different story. Um, yeah, and some of the example of what healthcare experience are volunteering, pharmacy tech, uh, you know, um, delivering patients meals, stocking supply, record keeping, etc. Uh, this is just I came up with this, but this is a little bit some tip for when you guys get to the interview. A little bit of interview etiquette. So in person, you don't want to be late, so check traffic ahead of time. You want to scout the area or map out the direction, how to get there. Make sure you sleep the night before if you can, and then just do your normal stuff in the morning. When you choose to dress professionally. Well, dress professionally, but obviously dress to impress. But if you're not sure what to dress, this usually go for the ladies because they have more options of getting dressed than just guys. We just put on a suit, shirt, or minimum shirts and tie. For guys, make sure good rule of thumb: make sure your belt matches your shoe. If you have trouble, figuring out what belt to wear or what color shoe. For ladies, err on the side of being conservative. But like Deion Sanders said, you look good, you feel good, you're gonna kill it. You're gonna do great. So dress how you feel. Obviously grooming, you wanna if you have facial hair, I don't have any. So that's not a big problem for me. But you have any facial hair, make sure you trim it or whatever way that you like to wear it. Make sure it's kind of look neat. Get a haircut. Guys, for perfume, for cologne, don't overdo it. No more than 2 spray. And if you do, spray one time on your wrist, dab at each other, and then start dabbing around. It stays so it won't be so overwhelming. Ladies, same thing. Go light on the perfume. When you shake, when you meet them, shake hands. Firm, but you don't want to be soft, but you want a firm handshake. Make sure you maintain eye contact. So for eye contact, it's really weird to look the other person in the eye. So what I like to do is I actually look in between, or I draw a triangle here, and I kind of pick a point on their face in that area and focus on it. And then occasionally I'll go back to the eye and then kind of back and forth. Body language. For body language, you don't want to sit back too much, like you're looking arrogant. I mean, sitting back does mean you relax and such, and open. You don't want to be too close, so you want to find a medium, but you do want to lean in. Kind of leaning in suggests that you're interested. So it's just that you paying attention, basically. The next advice usually go to guys. This is what I went through. This is the really old school advice. Guys, stand up when you see a woman enter or leave the room. It just shows that you're a gentleman, and then you show them respect. Okay. You don't have to do that. That's something I did. Funny enough, this actually helped me get one of my first job. So it's up to you. How you want to take it. Obviously, the other thing, make sure your phone, your electronics are on vibrates or silent. And I meant to say get business card. I missed the word card. Get business card. For who you meet is help with follow up. and it helps you remember, who you met with. Now, that used to be, if you guys happen to do that in person again, they have interviews in person again. Otherwise, the new thing is having virtual interviews. Now, for virtual interview, like I said, oh, these interview tips are really easy stuff. I think you guys probably think of this. It's not anywhere, anything like rocket science. But for virtual, same thing. Make sure you sleep the night before, no routine. Um, Pick an area that's clean and limited distraction background. So basically find a wall like this, empty wall, or if you want, put up a bed sheet. If you do choose to use a room, um, make sure your room is clean. Otherwise, angle it. What if you want to present, basically. And then also you find the right angle, you can make yourself look better, I guess. If you do live with roommates or with family, let them know ahead of time so they don't disturb you. Same thing for pets. Make sure you put them away. Uh, yeah. The other thing you can do prior to the interview, make sure your Wi-Fi is working. Make sure all your electronics and speakers and headphones are working well. This is something I did before that, we did this talk tonight. For eye contact is gonna be a little weird on virtual, but just remember to look at that little webcam right in the middle up top. This you see, all I've been doing is looking down at you guys instead of looking up. Same thing when you dress. Same thing apply to in person. Dress dress to impress, but professionally, and then but err on the side of being conservative. And obviously groom. Body language, same thing. Obviously, you can't do this standing up thing, but you can at least lean and you can show that you're interested. And the other thing is make sure you silent or put electronics on vibrate. Now, either mode of interview, you do want to thank the person at the interview after. Then you always want to send like a follow up email, usually the day after. The reason why I think follow up so important is it helps them remember you. It's another way for you to stand out, and it doesn't hurt. It takes like 5 minutes to do. So, it also opened up any opportunity for them to ask you any further questions or for you to clarify anything that you weren't able to answer before. So, follow up emails important afterwards. So, during the interview itself, so usually PA school they want someone that's mature, committed, and then kind of know what they want. Um, and then I learned this from one of my students this year is they actually prefer a student who take a gap year. Now this doesn't mean that you have to take a gap year. The student I was working with, she's a senior in college. She's graduating this May, and then she was applying this cycle, and that's what she shared with me. She was like, "Yeah, a lot." She was getting waitlisted a lot because the school was telling her like they don't usually take senior right out of college. But I help her. Like I said, we'll flip the script. I'm like, hey, just because you don't take a gap year doesn't mean that you don't deserve to be there. You know what you want, and there's nothing wrong with that. You could know what you want. You go after it. No reason. There's no need. You already confirmed it. There's no need to do anything else. Mock interview. I think mock interview is huge. Highly recommend it. Especially do interviews with people in the medical field or people that have in the HR position where they hire people or people that have experience with accepting committees. This is really big. Now during the interview process itself, what I found that helps you stick out is basically you should use your own personal experience. They want to know you, so just talk about you. Be honest. Don't try to bullshit. Because usually when you bullshit, it opens up for more difficult and follow-up question. This is where, this is another opportunity where if you have a bad grade, you can kind of flip the script and then explain yourself. Um, so I put an exam over. So I'm actually a 3-time applicant. It took me 3 years to get into PA school. Give me a sec. I want to spend some time on this. I want you to actually really share you what I went through, why I picked Howard, why it took me 3 years, and the process that I went through, after the first 2 year getting denied. So I applied to only one school, to Howard University. The reason why I picked Howard University was, number one, I want to stay locally. I didn't want to be too far from family, but it was far enough that I can be on my own and still experience things on my own. So from the state of Maryland, there wasn't that many PA school around. Number two, Howard didn't require the GRE. Number three, Howard didn't require bachelor either. And then at the time, they didn't require a lot of shadowing experience or, all that hours that you guys need to get these days. So did that hurt my chance of getting in? I probably, but it is the way it is. So I got to the interview the first time. First year I applied. I pretty much sucked. I bombed the first year. Like, I was just really bad at interviews. I just got all nervous. I couldn't talk. I couldn't think. I tried to BS stuff. I started giving BS answer, and then the teacher picked it up right away, and she asked me really difficult follow-up questions. Like, holy shit! Like, I just sweat. I just don't know how to answer, and so that's why I don't recommend bullshitting. So took an L, after the first year. Reapplied again the second year. The difference this time is I did more mock interview. I did more mock interview. I kind of learned the experience there, so I prepared myself better. Now, if I had applied to more school the first year, then maybe I'd take the L with the first program, but then take that experience, maybe go and do a better job with the next program. But that didn't happen. So the second year, I got to the interview again. This time I interviewed better, but I still didn't get in. I was devastated. There was pretty much the lowest point of my academic career. Basically, actually, almost lowest point in my life. This is where I really questioned if I should give up, if I was meant to do this. I was like, well, basically, what the fuck am I doing? Like, what am I doing all this for? So it took me a while to process that, but then I ended up making a decision. I'm like, I'm already at Howard. I only have two more semesters to go to get my bachelor's. I'm like, just finish out the school and then go from there. So by the time my bachelor, it's that time of the year again to reapply. Oh, I'm sorry. I need to go back. This is important. So after I found out that I didn't get in, what I did, I contacted school. I asked them, like, hey, can we do a review of my application? So I did. That's when it occurred to me that it wasn't my grade, it wasn't my application. That was that wasn't my weakness. I think it was still the the interview part. I didn't do enough to impress them. And the funny thing is, so they graded me on each school have a different way to grade you. But I was basically 1 point away from hitting that threshold that they would accept. That didn't make it much better to find that out, but at least, it was a hard pill to swallow, but at least I learned which one my strength and which one is my weakness, which basically what I need to work on. So third time, comes around, got to the interview again. Funny enough, that was the first thing they said to me. So, this is your third time applying? I was like, yeah, it is. And basically we got into I was still really nervous again. So I basically took a deep breath. I was being honest. I was like, hey, I'm sorry. I don't know why I'm so nervous. I can't get any words out. Kind of like what I'm going through right now. So I thought, let me just take a deep breath. And then, I answered him like, yeah, this is my third time applying. And, it took from there. Now, at Howard, the process of the interview, you have a written part, one-on-one, and then a group interview, basically a round table. So during the round table is when I started noticing that everyone was giving the same answer and they all seemed very generic. I was not impressed. I was like, that sounded the same thing with what they said. I was like, that is, well, at least I didn't find it impressive. But for some reason, something clicked within me. And then I only answered questions that I knew how to answer, but I used my personal experience. So my answer was completely different from everybody else. So that's why I said, I think this is how I stood out compared to the rest of the student. So, I use your own personal experience. No one's going to have the same experience you do. Quick example, the student that I had recently, the senior student, she actually had COVID and she had an interview and, she was freaking out. She didn't know what to do. She's like, man, should I go to this interview? Should I? Well, it was virtual, but like, she didn't know if she should be honest about it or not. So she's called me for advice. My advice for her is be honest and then control the narrative. Because like this doesn't have to be a bad thing. You can flip this and turn it into a positive because not a lot of students, like how many applicants are they gonna interview that have COVID that goes through it? You can share this experience with them. You can use this experience and make it that you stand out. So that's just my advice to you. You can take it how you like. You do want to at the end of the interview, you do want to ask some questions. And don't just ask questions just to ask questions. You want to ask them question that you want to know. Now, I know interview can be very nerve-wracking, but you got to remember they getting to know you, but you also getting to know them. You making sure that are they a good fit for you to go there. So don't give them all that power. Don't forget that. So ask questions that you need to ask. Find out what you need to know from them so it can help you make a decision. Because let's say if you have, you get accepted to multiple school, how are they going to decide which school do you want to go to? So this is where you ask them that question. So what to do after the interview? Like I said, do send a follow-up email. So you get accepted, awesome. Congrats. Go celebrate. Be safe. If you've been out of school for a while, then try to review a little bit. Kind of get used to, get back into what studying is like. If not, otherwise, go relax, go play, do a lot of relaxing and playing before you start PA school. Now, if you're on the other side where you get denied, same thing. This is what I went through. Obviously, I already shared that with you, but ask for a performance review. This is where you can identify, your weakness, if it's your application or if it's your interview skill or something that you can improve on. This help you figure out what you need to work on. You mope. I did a lot of moping, and then you cope with it. Remember, this is just a temporary setback. Get up, try it again. Now, this is gonna lead to the next slide. So let's just move on to the next slide. So, basically, after if you get denied, you didn't get in, you kind of have to do some reflection, evaluate if your current position, and then decide if this is if it makes sense to you. So consider cost, plan, lifestyle, other factors. Do you still want to be a PA? Great. Dust it off, work on what you need to work on, and try it again like I did twice, actually 3 times. But if you decide that, hey, you know what, this not really for me, then you can decide to pivot. I did have two students that pivot. I had one, I think she got to the interview. I don't know if she got in, but then her current job actually gave her a really good offer for a different position, and she chose, she chose to follow that route instead of going to PA school. Another student didn't get as far, but she was shadowing me at the time. Like I said, one of my one I wanted to help with help her figure out if this is the career that she wanted to pursue. And after a shadowing session, she decided, like, you know what, I don't see myself doing this right now. So she'd pivot and do something else. So yeah, reevaluate, pick what makes sense to you, and make a decision from there. But if you didn't get in the first time, don't worry, just keep trying. It means to be, you're gonna get it. Your hard work will pay off. These are the other options that I listed, for other healthcare options that besides just PA school. The reason why I picked these is they very similar in pay and also how long it takes. So for dentistry, you have a lot of that interaction with people. You can really develop a closer relationship with your patient, but it's limited medicine. Basically, you won't be limited from neck up, basically. For physical therapy is, you like to work with sports, you like to work with athletes, so you get a chance to work with patients. But the difference is you don't really learn a lot of that medicine. Like if someone get a cold, or I'm sorry, if someone have pneumonia or have an infection, they don't really teach the physical therapist how to treat that, but we get that benefit. So so that's medicine. The closest thing in medicine that you can do a combination of physical therapy and medicine would be orthopedic. I didn't know this before, but pathologist assistant, their initial is actually also PA as well. When I first saw it, I'm like, oh, there's another PA there. And then I found out, like, wait a minute, you're not a physician assistant. What is this? Yeah, but it's still involved medicine, but I think they more in the lab. They don't do much with patient interaction, but they do contribute into actual medicine where you have to diagnose, confirm certain cancer as such, and to help figure out the treatment. Pharmacy, occupational therapy. Occupational therapy is very similar to physical therapy. Anesthesiologist is assistant. I just found out one of my friends just went to radiology. Radiology tech school, and it takes about this around 2 years, and they get the salaries still pretty impressive. I think they depend, but they can make close to 6 figures. Yeah. So now that you get accepted to PA school, what to expect when you get to PA school. So PA school is going to be an emotional roller coaster. You're going to go through a lot of emotions. Excited, being overwhelmed, stressed out, sleep deprived. You're going to have a few mental breakdowns. I probably had 1 or 2. But these are all normal. And, everyone goes through it to some degree, and you're going to be just fine. The reason why it's going to be overwhelming is because it's medicine. There's so much information coming at you that you don't know what to do. It's basically, the really appropriate analogy would be trying to drink water from a fire hydrant. But the learning is different because it's more enjoyable. It's very engaging, it's applicable, and it's useful. So it's easier to learn in a way. You only get to know your classmate really well physically because you're going to be doing a lot of touching each other, doing physical exam, learning how to do physical exam. And it's a really rewarding experience. Because in my experience, I made a lot of good friends, lifelong friends from it. One of the funny things you'll probably go through this would be normal growth, discussing conversations during your meal is going to be very normal. This is our normal conversation. We're like, hey, my parent, my patient, shit themselves today, or my patient peeing on himself. Actually, this I witnessed on my own. I had a patient, he peed on himself, peeing on the wall, and he peeing on the hallway. And this is in front of everybody. This is when we didn't have a room for him yet, so we had to keep him in the hallway. And yeah, this dude just peeing everywhere. I was like, dude, come on, man, just tell me, So yeah, that's gonna be normal. And once you get to psych, what you get to learn in psych, you're gonna be secretly diagnosing yourself as well as your classmates. You don't think that, hey, they're gonna have some kind of mood disorder or some type of mental disorder. I'm not joking. Well, I don't want to make like a joke about it, but I went through that. I almost stopped myself. I might have some OCD or mental disorder. Key thing I want you to take away here is you still can have a social life, being in PA school. Granted, you do hang out a lot with your classmate, but you still can have a social life, and all the goods will outweigh the bad, and your effort is gonna be worth it in the end. Whew, that was a doozer. So, at the very last, just some closing remarks. My encouragement to you, like whatever it is that you can decide, that interests you, go explore it, go read about it, talk to people. There's nothing that will teach you better than your own experience. Number two, you don't have to be just a PA. This could be your stepping stone or foundation towards your next passion or your ultimate goal. For example, I have a classmate. He's an ER PA. He just launched his clothing line. That's awesome. This dude's gonna be a designer. For me, it's a lot of I want to try to branch out of teaching as well as business. The one takeaway, one thing I want you to take away is medicine is a lifelong thing. Lifelong commitment to learn, because you have to do CME, but it doesn't mean that you have to go to school forever. And also, it doesn't take a genius to learn medicine. It just takes persistent, some perseverance, and then the willpower to stay disciplined, and you'll learn. So, thank you so much for hanging out with me. I appreciate your time. Thanks for allowing. Thank you for allowing me this opportunity to help you. And uh, actually, I really like feedback. So if you guys can shoot me a DM, let me know what you like about this presentation. Also, what's something I can improve on. I also like constructive criticism. So yeah, how can I help? Let's get to answering some questions.
Definitely. We've gotten so many good questions throughout the course of this.
I haven't been looking into questions at all, so.
Oh, no, you're good.
No
So
worries.
on that note, I know you've been focused on your presentation, but I usually, say you might go back tomorrow and then look at the chat just to see the kind of feedback you've been getting. But never, and as long as we've done this, have I ever seen so much support from the chat for you. It is crazy, man. It's insane. You have to go back and look at this, because I saved a few of them just to give you an idea, but people talking about like, I've never seen this type of comparison before. It makes it so easy. Go Van, this is amazing. Like, wow. You're willing to apply more than once. It really speaks volumes. Thank you for being honest. Super informative session. It literally goes on and on, Van. Like, these people love you. So thank you so much. I just had to put that out there before we go to the Q&A, because I've never seen this much from the chat ever. So definitely something you did right there. So.
I really appreciate that, because I was nervous the entire presentation. I haven't been this nervous in a while. And like I said, I really put a lot of effort into this. We had practice run before. I actually had a practice run with another PA after you guys. And then not too long ago, I was freaking out because I'm putting in so much information. So I was sharing with another student. She was like, man, forget it. Just put all the information out there. And I was like, all right, I don't know how many times I edited this presentation. So it means a lot to me that you guys, that kind of comment that this, you find this very beneficial, that just validate all the efforts that I put in. So I really appreciate that a lot, guys.
Absolutely. Yeah. Wait, I mean, you totally deserve it. Like you said, we can tell in your presentation how much work you put into this. So it really showed.
Yeah, and that's actually something a lot of people are saying in the chat right now. They're saying that your passion is really shining through, and we can tell that you put so much effort into it, and they really appreciate everything. So.
Well, the other thing, I really hope you guys have fun, because this was meant to be interactive and fun. So
yeah, definitely. All right, so I guess we jump into a few questions here, and then we'll see where we go from there, right? Yeah,
let's do it.
Okay, perfect. So one from earlier, Brianna was asking, is it possible to work during PA school, or do you advise against it?
Good question. So most of the PA school will advise you not to work. My personal experience, I actually did work initially. Um, During my first semester of PA school, usually first semesters are a little bit lighter, so you can still work. Um, the other thing is the job that I had was very flexible. That didn't allow, basically, I can make up my time, my hours, and it didn't demand too much of my time. So if your job is um, flexible and allows you to work with you, then yes, you can certainly work. Now that's going to come down to how well your time management is, um, how efficient you are, how good you are at studying, because a lot of that can, when you're juggling multiple things, it can definitely take a toll on you. So I wouldn't recommend working, but it is possible. It's definitely is. It's possible. I went to school with that have family, that have little kids. So if they can do that, yeah. So it's a possibility. You just kind of have to really be good at juggling multiple things.
Awesome. Thank you. So Becky is asking, what's one of your favorite ortho procedures?
Ortho procedures, um, hip injections, especially with the ultrasound. Uh, in the old days, they used to do it without imaging, and obviously there's a really big bundle of nerve, artery, and veins there, the femoral, that you don't want to hit. So actually, a lot of doctors, even doctors, will shy away from doing this injection. And once I learned how to use it with the with the ultrasound, it's really easy and it's so satisfying because you can see the whole way. The funny thing was, I had this doctor. Um, he just finished his residency, so he came into my clinic and actually worked. And obviously, he didn't have as much of hands on in the field like I did, I think. But no, but he asked me like, "Hey Van, he had a patient that he's gonna do a hip injection on, but he was open enough to like, hey Van, can you help? Can you help me do it?" Actually, he asked me, "Can you show me how you actually do this hip injection?" So I show him my setup, how I place a patient and how I cut the gown so I can basically cover the patient and expose what I need to, and then still keep the decency to give privacy to my patient. And did the injection, and afterward he was like, "Dude, I love what you did. Like, I love your setup. You make it look so easy." And yeah, so that's one of the procedure that I like to do. Um, in ortho. Trying to think of other procedure that I like to do.
Oh yeah, that's really cool. I didn't even know that was a thing, using ultrasound to do an injection like that. So I guess that goes along with your natural affinity to be able to do those kind of things.
Oh, ultrasound is big. Like, ultrasound is way underrated. You can use it so much. It's so useful. Not in just orthopedic, but you can use it a lot in an emergency room. You can quickly diagnose a pneumothorax. You can quickly diagnose blood in the abdomen. Just it's so easy and cheap to use. So ultrasound is actually a really good skill to have. It's awesome. It's an awesome tool.
That's really cool. When I think ultrasound, I always just think like pregnant lady having a baby,
Right, so. Exactly. Yeah, I mean, that's just naturally what most for. So
perfect. Let's see. So some application type questions. Somebody's asking, do you think it matters if they take some of their prerequisites at a community college versus a university? And do you think schools look down on
that? Great question. Well, the number one thing you got to make sure is if that school would accept credit from a community college. That would probably be your number one determining factors, right? Number two, I don't think school would look down on you. Now, I can't really say this because I'm obviously not part of any any acceptance program, but from my experience, a lot of my credit was was from a community college. So I think it speaks for itself. So I don't really think they will look down on it. I don't think the quality of the course, because I know some community college had way more difficult course than college did. But the number one thing you want to know, you want to make sure that your credit would transfer, and then the school that you're trying to get into would accept it. That would really be the determining factor for you.
Perfect, thank you. And more on that note, Lauren earlier was asking, who did you get your letters of rec from?
I let my letter of recommendation. Funny, it changes each year. So the first year was the head department that I volunteer for, and then the PA that I shadow. Second year, I I think it was my organic professor. He gave me a glowing review, so I kind of had that going well, before I asked him. Because when I was in his class, he was making this comment, man, you're asking kind of like pretty high level kind of questions. So we had a pretty good relationship. So I asked him, my Ogo 2 teacher, to write me a letter of recommendation. Yeah, and I'm trying to remember who else I asked. I think those are the 3 people that I asked.
Okay, awesome. And then, so I know you talked about being nervous during the interview process. So Michael is asking, what are some tips to avoid being overly anxious?
This is a tough one. No one thing I would say would be, keep in mind that this is gonna treat it like a conversation. Like, keep in mind that it's you're not trying to interview for something big. Just think of it that this is gonna be a conversation, that you just having a dialogue. The other thing is, stick to your experience. It's usually when people speak about themselves, they talk about themselves, they tend to have a different kind of energy, and they tend to be more calm. So that's what I. The other thing is practice. Just talk to people a lot, and the more comfortable repetition you get with saying that, I think the more comfortable you would get. Hopefully that helps.
Yeah, definitely. Thank you for that.
Thank you.
Let's see.
So someone's asking, do you have to get a certain certification to work in an orthopedic specialty or any specialty?
Great questions. The answer is no. However, there are certification that you can take. So there is one certification for orthopedic, but I didn't take it. I know there's one for internal medicine. My friend actually took it. The reason why I didn't take it is, well, I don't see any benefit of having it yet. I didn't really do too much research into it, so I haven't taken it yet. I might take it in the future.
Awesome.
Okay, and just briefly back on the topic of letter of recommendation, somebody was asking a more specific question. She said, do you think it looks just as good to get a letter of rec from a non-science teacher? So in this case, it's with her humanities teacher, but she says, do you think it seems more professional to get it from a science teacher, professor?
Good questions. I think if that person is going to give you a raving review, I mean, a really awesome letter of recommendation, then no, I don't think it matters. If it's I don't think letter of recommendation will weight more than the other. If anything, I think it'll will give them a different perspective outside of medicine. So that can be refreshing to them, because
Yeah, for sure. Kind of that unique take after they've read like so many biology 1 teachers. So this was a popular question from Jordan. She says, I think you mentioned that you weren't totally sure if the PA profession was for you while you were researching and shadowing. So how did you articulate that in your PA school interview?
So the first year, obviously one of the easiest questions was, why do you want to be a PA? I couldn't answer it. I was stumble to get my words out, and I'm like, oh my God, I practice this. I know why I want to be a PA. For some reason, I couldn't, but I wasn't sure of it, so I couldn't answer it. And I think I say so that, oh, this is going to be like a stepping stone to go to med school. Wasn't a good answer. Wouldn't recommend that answer. Really, how I determined that PA school was for me, basically, reflection after that first interview. Med school was too long, cost too much. It wasn't what I wanted. PA school was a good middle that I can still be in medicine, make my parent happy. It also makes me happy. So I think that's really how I really narrowed down PA school. And yeah, how I settled on PA school. Oh, and then how I articulated it through my interview. Basically, I the way I articulated was, the reason why I became a PA earlier. That was how I articulated to them. I told them, basically my reason why. I think I had like a list of 4 reasons why I wanted to be a PA, and that's how I articulated. I didn't say so much like, oh yeah, I used to do this, and then think about med school. And I know this is it. This is why I want to be a PA. Hopefully, I answered your question there. That was a really long answer.
No, yeah, I think you did, and thank you for that. How are we doing on time? I just want to make sure we're being respectful of your time. I know you put a lot into this. So.
No, I plan. No, we're good.
Okay, so maybe
yeah, I'll make time for you guys. So no worries. I came across a question by Annabelle not too long ago. Let me just answer this question.
Sure.
How many years of being a PA did it take to be able to feel comfortable working autonomously? Most of the time, I think this will go across the board for all PAs. Usually when you spend the first year just studying and like learning your craft. I think it's in my second years when I started to feel a little bit more comfortable, but it was really during my third year I really feel comfortable. And this one I actually, each time I show my progression, I show there's an increase in my knowledge to my supervising doctor. So between 2 and 3 years that's when you become you gain that skill and you become more comfortable, and then you also earn the trust of your supervising doctor. And the more trust you earn, then the more autonomy you get.
Yeah, and it sounds like you can make a presentation about that alone. It sounds like you have really good rapport with your all of your associates and your doctor and all that stuff. But let's see. So Teresa was asking, what type of questions did they ask during interviews?
Honestly, generic questions that, if you were to look up what the typical question they ask in an interview, that's what they would ask. Basically, why do you want to be a PA? A lot of situational questions were like, regarding your academic integrity. Basically, hey, if you see, let's say you would take an exam, you notice somebody's, one of your classmates cheating, what do? Other things, what are your strengths and weakness? That's a really basic question. I'm not sure they still ask that, but it's relevant. What other question I can think of? When's the time that you had to, have a face a difficult situation at work, or an argument with your coworker? How did you go about it? How would you describe relationship between a PA and a doctor? One of the best thing I read, best analogy ever. Or how would you describe that relationship? Batman and Robin. I was like, dude, that was genius. And yeah, that's really they both working towards the same goal, but they're working in tandem. And that analogy is explained it so well and really creative. Except I didn't come up with it. What else do they ask you during interview? What do you do if you disagree, with the doctor's opinion? So a lot of situational question. They really just want to know about you. Obviously, they're gonna ask you, "Oh, tell me a little bit about yourself." Yeah, so things like that.
Awesome. And I know you kind of went over this topic in your presentation, but I've seen the question a few times. So if you don't mind reiterating, a lot of people are just asking, what were the main things that you focused on in between your application cycles to better yourself? Like whether that's application wise or emotionally, like mentally, however you did.
Good question. So after the first year, after the first year, I kind of learned that they invited me in to the interview for a reason. So my application was obviously decent enough to get invited. But after that first year, I knew. So I realized that my application was enough to get to the interview, but my interview skills was suck. So between the first and the second year, that's what I practiced on. Improving my interview skill. So that's where I did a lot of mock practice. I'm sorry, mock interview with people. I don't remember how many mock interviews I did, but I did it with a pharmacist, and I also did it with people I didn't know. So that's basically when you go to interview, you may not know this person. That added a different kind of feel. It makes the interview feel a little bit more real. After the second year, where I was really devastated, let me see what I did emotionally and mentally. Well, emotionally, I was really upset and devastated. But I got over it. I realized that, you know what? I don't have to figure it out my direction right now. Let me just kind of, and also, instead of spending time and all that energy being sad and move about it, and basically thinking what I could have done better or what things that in the past that I can't change, I put that energy into, you know what? I don't know what I'm gonna do yet, but I'm here now. I'm not too far away from getting my bachelor. Besides, I already have a scholarship that pays for that. So let me just finish this, and then things will come up, and then hopefully let me finish this, and then I'll figure it out further. Basically, that's my thought process, and that's how I went about it. I also did sports and stuff to kind of get that off my mind. Usually, that's what I do. Kind of help me kind of blow off some steam and clear my head.
Yeah, definitely. It seems like you gotta have something to blow off some steam, otherwise you'll go crazy, right?
Yeah. Oh, and also, I'm sorry. Again, I didn't really see any other options. I be stupid as they sound, I didn't take my own advice back then. Well, granted, I know a lot more than I knew back then, so I didn't really explore any other options. I just knew I was so focused on being a PA. Like that's what I really picture myself doing. Like I really enjoy. So I kind of went after it. This is what I want to do. I was pretty convinced of it. So yeah.
That's incredible. The story definitely has a happy ending because look at you now, right? Like
yeah. It definitely could have been a PA sooner, but I don't know, things happen for a reason, I guess.
I mean,
you're here now, so
yeah, and just the way we know you, it doesn't seem like you're a regretful person or anything like that. If anything, it seems like that experience made you a better person, right? You're stronger, you're giving back to the community. So I guess all those things happen for a reason, and here you are doing well, providing patients with amazing care and giving back to students like us. So we couldn't appreciate it anymore.
I appreciate the kind words, guys.
Definitely. All right, so maybe a couple more questions, and then I guess we can call it a night from there. Let's see.
Yeah, I know, I know I gave you guys a lot of questions. I mean, sorry, not a lot of questions, a lot of information. You may not be able to process everything, so question doesn't pop in. It hasn't settled in yet. So if you have a question that you think of later on, feel free to shoot me a message. Otherwise, maybe the other option, maybe we can do another session to do a Q&A session if needed.
Yeah, absolutely. We're very open to that. So definitely, if you want to come back, by all means, you're the first guest. So let's see. Somebody was asking, she's Vietnamese herself, and she understands the type of pressure that comes from your parents. So she's asking, how did you deal with your parents throughout the whole process?
So interestingly enough, my first when I was at the community college, I was studying for medical technology. Basically, there's a lot of lab stuff, and then basically, my parents like, oh, well, I was still young at the time. They're like, all right, whatever, you can study something. But I found out what they actually do as a medical technologist. I met a lady. That's what she does. She told me about it. I was like, I realized this is not what I want to do. Like, I like interacting with people. That's not fun. So I changed my mind, and I was going to go into nursing. Now, when I decided to go nursing, I told my parents about it. I'm like, hey, I'll consider nursing school. First thing that came out of my dad's mouth was, dude, that's a woman's job. What are you doing nursing? Obviously, I was very taken back. I was like, dude, that's wrong, but all right, I get it. So when I stumbled across PA school, so I basically told them, I'm still going to learn medicine. It's not the same as a doctor, but I'm actually doing the very same, pretty much. So in Vietnamese, we actually don't have this profession, number one. So it's kind of really difficult to explain to them what it is. But I was able to explain to them, like, yes, I can do similar things that a doctor do. I can still see patients. Right? I basically tell them what a PA does. I write prescription, I see patient, etc. And that's what helped convince my parents that, okay, you're still doing medicine. It's good enough. So yeah, that's how I went about it. I met another professional, a pathologist assistant recently, and she's Vietnamese as well. So she had actually everyone in her family was basically doctor. I think they were all doctors, and she was the only one. She was under pressure going to med school, but she really didn't want to go to med school. So she found out the pathologist, but pathologist assistant, and it still involved medicine, and she was very brave to. Well, her family kind of accept that, I guess. Yeah, that's that you. I would have to refer you to her so she can explain it better. But yeah, that's how I went to the process I went through with my parents.
Awesome. Thank you for talking about that. Seems to be like a big subject, is that familial pressure. It's not really a whole like very explored topic, but definitely an issue.
Yeah. In Asian culture is definitely a lot of pressure. I'm sure a lot of Indians parents will say the same thing. Will say the same thing too.
Yeah, absolutely. I'm right there with you guys. But yeah, so kind of wrap it up. I really like this question just to end. So asking about the future of PA, where do you think the profession is going to go? So if you could touch on things like, how do you think their role in medicine is going to change? Do you think the profession is going to become really popular, less popular, saturation? Anything you want to talk about the future of PA?
Okay. So the PA profession itself, to speak conservatively, it's been top 5 the past 5 years. I think it's probably the top 5 profession the last 10 years at least. I don't know this number on top of my head, but according to BOS, they actually tell you how much the profession is growing. So right now, COVID does affect the economy, and it actually affects everyone from doctors to PAs and so there's a lot of new graduate PA that are having a difficult time finding jobs right now. Doctors have to take pay cuts, but I do think once this we get over this COVID and things go back to this normal, I think the job market is gonna open back up. You in medicine, they're always gonna need medicine, and right now there's a lot of students that for the same reason don't want to. PA school is more attractive than medical school because it's a lot shorter. So I think the job market is gonna continue to grow. I don't think we at that point where we saturated yet. So yeah, I think it's gonna keep growing. I know there's a big push to change the name right now. So I'm not sure how that's working out, but uh, yeah, so we have to kind of watch. And then I don't know if things will be turned to a doctoral program. This is something personally I think is kind of weird because like you call yourself a doctor PA, like I don't know, that just doesn't make sense to me. uh, but yeah, intermediate profile, I don't think we saturated yet. It's still gonna be the next 5 year. I predict it's still gonna be the top 5 profession easily.
Definitely. Well, all right, Van. Thank you so much. I mean, I can't thank you enough. This has been an incredible session. We really appreciate you taking all the time, all the effort you put into this. You know, your story, sharing such a personal, honest, genuine. Like, you're really the embodiment of perseverance. Like, I hope that a lot of people are inspired by this. I know we definitely were when we heard it the first time. It's just, you know, it means a lot that you're able to talk about this kind of thing because it's not always you get accepted on the first cycle. It's not always you're the best candidate, right? We're real people, you know, we're human beings. So the fact that you can talk about improving yourself, you know, getting over whatever you got to do to make yourself better. We really appreciate you doing this.
Oh no, thank you guys so much for having me and letting me talk and allow me the opportunity to share my experience, actually help you guys. I think I shared this experience with you guys last time, but I didn't share with the rest of the audiences. During when I was in PA school, I was walking through class, empty hallway. I was going through my class, and there was an upperclassman that I didn't know about, and then he stopped me. He was like, "Hey, you Vin, right?" I was like, "Yeah." And he, and then he was like, "Oh man, my class know about you. You took you 3 tries to get in." And I was like, "Yes." I was like, "Whoa, I don't know you. Like, I don't know how'd you know that." But but he was just saying, like, "Dude, like, yeah, hearing your story is like, yeah, so inspiring to him, and then it's inspiring his classmate that to kind of push through. They almost finished, and he was kind of giving me advice like, dude, you worked so hard to get here. You're gonna do great. Just keep doing what you're doing, and just like what you just told me, I'm not good at receiving compliments and like things like this. So I was like, oh my god, I didn't know how to act. But it's bro, it's kind of different joy that you feel like, wow, I can be in motivation to somebody. Like, oh my god, like I never really thought myself as a role model or anybody big to motivate somebody and inspire someone. So it's amazing to hear that, and I'm really honored.
Yeah, definitely. I mean, you have so much heart. You have so much heart. It really shines through. So, I mean, we can't thank you enough. Like you said, we'll be more than happy to have you back. When you said that, a million people were like, yes, bring them back. We have to have them. So definitely. We'll look forward to that in the future.
Yeah, no, yeah, we can. I don't know. We can figure it out if they if if you guys will want me back, or if you guys have further questions. Like I said, I'm open to it. So please reach out to me, shoot me a DM of anything I didn't answer. Just ask me there. I'm willing to help you in any ways that I can. To help you guys.
Oh yeah, and on that note, I'm sorry I forgot to say, Van's Instagram is right there on the slide, and we'll post it in the chat as well. We've been following it for some time now, and we've seen it grow. It's really cool. He posts some awesome like orthopedic tips, life stuff, really, really interesting information. So we highly recommend you guys follow. And I mean, I couldn't think of a better opportunity than to reach out to somebody like Van that's capable of like really relating to you and have him answer your questions directly. It's priceless, guys. You got to take him up on that. So highly recommend. Van, I'm sure your inbox is going to explode after this, but
I don't know about that, but we'll see, man. Thank you for the kind words again, man. You're gonna make me blush.
All right, man. We're gonna start sending that quiz out. Thank you so much again for joining us. We really, really appreciate it.
It was incredible. Thank you again.
Awesome. Have a good night, guys.
All right, take care. Thank you again. Wow, really good session. Amazing. Well, thank you guys so much for staying tuned with us. We really appreciate you all being here. As always, we're about to drop the link in the chat for the quiz. Nothing tricky. This time it's going to be a little different format. Do you want to talk about how?
Yeah, we did this format just once with Brianna's session, since she just did a Q&A session. It'll just be 3 questions. They're still multiple choice. The only thing is we added a small summary at the end. So as long as you answer 2 out of the 3 questions correctly, at least 2 out of the 3 correctly, you'll get the certificate. And then just include like a small 2 or 3 sentence long summary at the end, and then you'll get that within at least a week.
Awesome. Yeah. So, like we said, nothing tricky. We just want to make sure you guys are here. And obviously, you've all been hanging out, interacting in the chat. And thank you so much for that. We watched the chat the whole time, and it's so cool to see you guys, answering each other's questions, breaking into these little side conversations. That's what we're all about. Because I mean, at the end of the day, this platform is just to help pre-PA students. We're in the same boat as you guys. We're not here to charge you or anything like that. Obviously, we ourselves don't have much experience in the field, so the fact that we can meet with these PAs and collaborate and do this cool kind of stuff is just like, it's amazing. But
so fun.
yeah, seeing you guys it makes this entirely worth it.
It's so amazing seeing what this community is like, and it's really motivating, and everybody's so supportive, so we really appreciate it. And like he said, we always see the chat, and when somebody's asking a question and you guys already know the answer to it, so you respond for them or for us sometimes too, and it's awesome. So thank you again, and I'm about to send the link for the quiz. So yeah, guys, stay posted. Instagram. We will be announcing our next sessions coming up pretty soon. I think our next one is going to be on Monday. Yes, it's on Monday at 8 p.m. Central. She's doing urgent care, so it's another urgent care session.
Yeah, it'll be really cool. And stay posted, because we're switching to the format of where we're going to have at least 1 speaker a week. It's getting really crazy. We have a lot of PAs actually reaching out to us, hoping to do sessions, which is amazing for you guys, because a lot of different specialties, a lot of different ways to get experience, learn, make these connections, and also very importantly, the reason that we kind of started this thing, get your shadowing hours. We'll be sending out certificates for everything. But yeah, really cool stuff coming up. Yeah, guys, I think that's everything. Well, thank you so much. Quiz is out, or will be in just 1 second. Sorry. But yeah, so we'll hang out in the chat. If you have any questions or anything, technicalities, want to say anything at all, we'll be right here. All right. Thank you so much, and we will see you next time. Take care, everybody.
Bye. Have a good night.